We are extremely fortunate at the Miami Cancer Institute to have all major radiotherapy platforms under one roof. We know that each and every radiotherapy tool has certain specific characteristics that make it unique and potentially highly applicable for a given patient. But when you have a whole panoply of these tools, you can test each tool for each individual patient's specific tumor in a given location, and then select the best and most appropriate technology for treating that patient. The assessment of various technologies to apply to a given patient is a relatively new phenomenon in radiation oncology. And as a consequence, there are no standardized measures to decide which particular plan is superior or inferior. The approach that we take is to try and learn from individual cases and try and generalize hypotheses from those cases. So for example, if we have a patient where the lateral penumbra might be the most significant limitation, we would then test the proton beam plan, for example, with a photon technology that might perhaps have a superior lateral penumbra effect. If, for example, it's only the distal organ at risk that's crucial, then it's obvious that very few technologies would beat proton beam therapy, and in that case, the comparison planning may be quite simple. Proton therapy is a very important tool in our armamentarium. We see a lot of patients with very complicated diseases, with large sections of the body that need to be treated, with many organs at risk in significant proximity to the targets. For those patients, proton beam therapy gives us a unique opportunity to spare multiple targets at the same time without exceeding low-dose normal tissue to targets at a distance from the specific target of interest. These patients are clearly treated much better with proton therapy than with any of the technology that's presently available. We are extremely happy to host the IBA Proton Users Global meeting here in Miami because that allows us to interact with the largest community of proton users in the world today. Each proton center has developed techniques, technologies, lessons, experiences that are unique. And for each center to replicate each one of those experiences would take decades of work. A forum, such as a users group meeting, allows us to share those ideas, best practices, innovations, and in fact, to collaborate, both on research and clinical applications. Our recommendation for new centers coming online regarding ramp-up is to try and target yourselves to a handful of diseases first, things that are relatively straightforward with few complications. So as an example, we decided to avoid targets in motion at first. We also decided that we would not take very complicated targets. Even if you desire to start simply, children who require craniospinal radiation will rapidly come to your doorstep, and one has to make an accommodation to treat these patients quickly. So although it's a balancing act and one should start simply, which is exactly what we did like most other centers, the ramp-up then has to take into account the specific needs in your area that need to be accommodated. IBA has been a superb partner for us. IBA has been available for all service calls, for potential research plans, for timeline discussions. If there are issues with the machine, there's been clarity at every step of the way as to how things will be resolved. They've been a tremendous partner. We've had a great time working with the IBA engineering team because we've learned with them. They've been receptive to our ideas and suggestions. There are times when we've disagreed, and we've had open expressions of disagreement which are resolved in a manner of friendly, cordial relationships. And that's a superb example of a two-way relationship.